can hardly bend it now.
Is it okay if I take a look?
Go ahead.
Okay. It's definitely swollen and seems inflamed. Can I make a couple of suggestions?
Of course. You're the doc.
You already told me that this hurts a lot, and I'd hate to see you dealing with this pain for any longer than necessary. I want to see your knee healing as quickly as possible so you can get back to exercising. You've been doing a really good job with that. So here's what I propose. First off, I recommend you see an orthopedist to take a look at your knee. Second, in the meantime, I'd like you to take some anti-inflammatory medication that will also help with the pain.
Doc, is the medication really necessary? I saw this show about how too much medication isn't good for you. When I was growing up, we just wrapped bruises and swellings with cling wrap and sort of sweated it out. Could I do that instead?
I heard about the cling wrap method, and it works for certain types of injuries. In my experience, an injury like yours should be allowed to cool, and cling wrap can make it overheat, so I would not recommend that. In terms of the medication I will be prescribing you, there's a lot of research on it. No study has ever found negative side effects to short-term use, which is all I'm recommending, and I've never had patients who seemed worse off because of using it. The choice is yours, of course, but I recommend using the medication in order to accelerate the healing process and reduce your discomfort. This will get you exercising sooner, which will be good for you in many ways.
Okay, Doc. That sounds good. Thanks for explaining.
You know, I'm really impressed with the changes you've made in terms of eating and in terms of physical activity. Your blood pressure is already lower than the last time we met.
Thanks, Doc. I'm trying.
For now, you should stay off the knee, so no long walks if it hurts. Keep doing what you're doing in terms of food and see if you can add a nice serving of salad to the start of every meal. It'll help fill you up, so you'll probably need less of the main course and less dessert.
That makes sense. Good idea.
I think it won't be too hard for you once you get used to it. It just takes a little planning ahead, which I'm sure is something you can do.
Thanks, Doc. Yeah, I think I can do that.
Excellent. Yes. You've been making great progress so far, and you're already starting to see the benefits in terms of blood pressure. Keep at it, and you'll be feeling better and better.
That sounds good, Doc.
Great. I'll go write some notes, give you a referral for the orthopedist, and give you a prescription for the medication we talked about.
Thanks so much, Doc. I appreciate it.
It's my pleasure, Mr. DeVita.